morning to everybody, and welcome back to New Day Northwest. We're all concerned with the condition of our skin as we age, and most of us use skincare products and sunscreen, but might not be open to going under the knife. But now there is a new treatment on the market that's said to have nearly identical results to surgery without the same risks. Award-winning, board-certified facial plastic surgeon Dr. Wayne Larabee is here to tell us more. Good morning.
Good morning.
That's good news, because I don't think I have the courage for the big kahuna operation,
No.
but I'd love to hear about these smaller things.
You don't need anything yet, so
thank you,
I'll come back in a few years.
I don't know if it's true, but I love you saying it. So what are the things that are available to us now?
For skin treatments, well, we try to prevent problems before they happen, and so we have a real nice aesthetic center with some dynamite staff. But we try to help the patients prevent by avoiding sun and by not smoking and having good lifestyles, but also good skincare products, good sunscreen. The more minor maintenance things like using microdermabrasions and more sophisticated chemical peels. But over time, you know, when we can't do those small things anymore, then we go to the next step, which is bigger things.
Stuff happens, and we need larger weaponry.
Exactly.
So is it called Ultherapy?
Ulthera, yeah.
Yeah,
Yes.
okay, Ulthera. Okay, so what is that? It's obviously a new technology.
Yeah, well, it's majorly cool. In the old days, we had different technologies to try to tighten skin by heat, basically. And this is ultrasound. And the cool thing about it is that the ultrasound, it's the same ultrasound that you use for pregnant women to look at their babies, so it's safe. But it goes through the skin safely, but then it focuses deep and tightens the skin deeper. And it goes quite deep, 4.5 millimeters by which is pretty deep by our standards.
We're looking at it right now. Is
Yes,
it uncomfortable in any way?
It's a little uncomfortable. It's not bad, though. Some people have no sedation. We can sedate them a little bit. This is my Lauren, who does most of our therapy in the office, doing it. There's two cool things about it. One is that because it focuses deep, it doesn't harm the overlying skin, and it's really minimal downtime. The second thing that's cool, as we'll see in a minute, I think, is that we can actually see the skin. It's ultrasound, so you can see where you're going. You can see the surface of the skin, you can see the deeper structures, you can see the bone. So you know exactly where you're going, which really, I think, improves the outcomes.
Let's take a look at the before and after. So here's a before, and this is, you know, kind of the typical thing that happens with age, a little bit of loose skin there.
Exactly.
That Nora Ephron wrote about in her book, I Hate My Neck. And wow, look at the results.
Yeah, that's a result, and I think it's pretty obvious what's happened there. But it's, you know, it takes, it's one treatment only, which is nice. That's an excellent result. Of course, they're not all that good, but we have a lot that are. The original studies were done by some friends of mine, and they found that about a year out, they had really nice results. It was originally done for brow lifts, and they noticed that they had it like a year out, still they had like 6.5 millimeters elevation, which is quite a bit it's almost as good as a surgical result. So,
can I get this done on my whole body? Is that possible?
Well, the short answer is yes. It's only FDA approved for certain areas, but
I say we go for it. All right. So let's talk about some other non-surgical fixes. But actually, before we do that, does this work for everybody? You say some people get better results than others. Can we know ahead of time by looking at the condition of our skin?
It's like any other medical procedure. We have to make a diagnosis. We make that by evaluating the patient. And, you know, if somebody comes in and they're older and have a lot of excess skin of their neck and jaw and lids, I mean, they're not going to get a great result without surgery, with facelift or eyelids. But you can get them improvement. But it's really, really excellent for the younger patient who's having early signs of aging but doesn't want to do something surgical for jowls and neck. And that's really our core audience, for lack of a better word. But older people that try it a lot of times like it because it's not great, but it's good.
Any improvement makes you feel better, so I mean, it doesn't have to be, I realize you're not going to be able to turn me into, you know, Miss America. So what about Botox and fillers? What are the latest things with those? Well,
there's really two components of aging. One is, you know, as we get older, our skin ages and we have descent of the skin, and that component we're treating with surgery or Ulthera. The second component is really, for lack of a better word, deflation. I mean, we lose volume to our skin, you know, lips, cheeks, etc.
And gain volume other places.
Exactly.
Volume shift that happens.
You know, we have some great new fillers, and there's a whole spectrum of them, more from hyaluronic acids to other ones that are more permanent. But by combining fillers to fill out, we get a more youthful face. We combine those with Botox to prevent wrinkles, as well as taking care of some of the structural components. And by very carefully combining those, we can give a really natural result. And so
that's great.
It's good.
So there aren't really strict rules about what age which thing is applicable to. It's really more on an individual basis, right? Having a consultation and seeing what you personally need.
Right. People age, for example, in quite different ways. I mean, part of it's your gene pool. I mean, what what parents you picked, and the second thing is the
so hard to do that well.
And the second, of course, is your lifestyle and smoking and things we've mentioned. But you really have to individualize it. Some people that are quite older, we can do some minor things and make them look great, and sometimes younger people need more major things. But we really try to individualize the treatments.
Well, I like the idea that there are things out there without having to necessarily cut the skin and go through all of that. So that's wonderful news. That lady must have been thrilled. Yeah. Was she incredibly happy?
Yes.
Yes, she probably went around like this for the rest of her week. Thank you so much.
Okay,
we appreciate it, Dr. Larabee. For more information, or if you'd like to book a consultation with the Larabee Center, please just visit our website, king5.com/New Day. We'll link you right over. It seems like a very good idea. Up next on New Day, Kelly Moore shows us how to throw an easy and chic fall dinner party. We'll be back in just a moment.